order at 10:32. Roll call, please.
Commissioners Powell.
Yeah.
Ginjal is absent with notice. Gershenson.
Here.
Taylor.
Here.
Erickson Galt is hopefully gonna be here soon. Nelson.
Here.
Cabell is going to be here soon. Joliet.
Here.
Lutz.
Here. Thank you. Please join me in rising for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Our first item is approving the minutes from November 28, 2023. I have a motion by Commissioner Nelson, support from Commissioner Joliet. All in favor say aye.
Aye.
Opposed? All right, the minutes are approved. Next is approving our agenda. I have a motion by who? Who would like to have a motion by Commissioner Nelson and support from Commissioner Joliet? All in favor of the agenda say aye.
Aye.
Opposed? All right, our agenda is approved. We have 4 items under communications.
Public comment first.
Thank you. All right, we move on to our first public comment for items on the agenda. Is there anyone from the public wishing to comment on items on the agenda today? Seeing none, our first public comment is closed. Our next agenda item is communications with 4 items. The first is medical marijuana operation and oversight grant application. The second is an amendment to the agreement between Oakland County and Honor Community Health. The third is the final report for Oakland Together Mental Health and Wellbeing Nonprofit Grant Program. And the last item is the program quarterly report from Haven. Are there any comments about communications? Then I need a motion to approve. I have a motion by Commissioner Powell, support from Commissioner Nelson. All in favor say aye.
Aye.
Opposed? Communications are approved. We move to our first regular agenda line item, Circuit Court recommendations. This is a position creation. Who would like to make a motion? A motion by Commissioner Nelson, support from Commissioner Powell. And we have Susan Hollier here to address this item.
Hi, I'm Suzanne Hollier, the Front of the Court Director, and I'm seeking to create a case specialist position. We have been doing more and more work in providing services to the cases established by our prosecutor to have them provided some of the same services that our private clients who come through the divorce process receive in terms of like early intervention. So we've been providing what we've been calling pre-trials for Judge Langton's docket to provide those clients some early access to our custody and parenting time specialists and referees so that I've learned through 20 years of doing this that the earlier we can get in and help people start resolving problems, the fewer problems they have down the road once they've really become angry with each other. So it's been helpful. It was a big success on Judge Langton's docket. Judge Gorsko would like us to expand it to her docket. I've been myself doing all of the work of sending the notices and directing traffic, and I can't as we move to the other 6 dockets. So this is to create a case specialist docket that can help with that. And also, to be honest, our case specialists are like the unsung heroes of the counties. They deserve an award. They take a huge volume of calls and process a huge volume of paperwork and could really use a hand in keeping up with that. So in this person's spare time, that's what they will be doing, is helping their colleagues.
Yeah, I agree. And early intervention and prevention is the best policy and step forward. Are there any other comments regarding this? All right, would you prompt the vote, please?
I have 6 yeas and 0 nays.
All right, the motion is unanimous. Thank you.
Appreciate it.
Thank you.
Thank you.
Our next item is from the District Court, 52-1 in Novi, another position creation. Anybody want to make a motion? I have a motion by Commissioner Joliet, support from Commissioner Gershenson. And we have Alexandra Black here to talk about this item.
Good morning. I'm here with Brett Derry, who's the Court Administrator in 52-2 District Court in Clarkston. We're requesting the creation of 2 Deputy Court Administrator positions that would be for the 52nd District Courts, but would be assigned to the Clarkston 52-2 Courthouse and 52-4 in Troy. So a little bit of background for new commissioners and some that have been here. The district courts were created, I think, in 1968, and the structure was created at that time and really hasn't changed much since the creation. But obviously things have changed and evolved, caseloads, IT, all types of things have changed amongst the courts. And we've been asking for these positions for the last couple of years and haven't had any funding for them. And we were advised that we would be denied until we could come up with some funding. So luckily, Governor Whitmer has signed that we no longer have to pay for our JAS fees starting in fiscal year 2024. So that went into effect October 1. And that saved
What are those fees?
Judicial Information System fees, JAS. So those are that's the system that we use to provide and house all of our records. So without those fees, it saved approximately $210,000 a year for our budget, and we would like to utilize that for these positions. We have enough for this fiscal year to cover this fiscal year, but as you know, when you budget for positions, you have to budget for a higher step and you have to include the fringe benefits at a higher rate. So we may or may not use all of the money next year, but we have asked for a contingency match from HR and they did agree, fiscal agreed. So everybody's in agreement, which is fantastic for us. So we're here to ask for the creation of those 2 positions going forward as soon as possible.
Thank you. Comments regarding the 2 positions? Commissioner Gershenson?
I'm sorry if I missed it, but so will one be at Clarkston and one will be
In Troy.
in Troy?
I already have
Permanently.
one. Permanently. I have one and Rochester has one. That's been our structure from the beginning. I think originally they thought, well, they're smaller courts, they don't need, the hierarchy, but the problem is you have basically court administrators and then the next level is a supervisor. And when the court administrator is gone, it's unreasonable to ask the supervisor to run the court, especially at the pay level and responsibilities that we're asking. We're at an increased liability when we're doing that.
So just one more thing, I know room is an issue, space is an issue for you. You
That's
have
good.
space.
She's gonna let the person sit on her lap.
I know, right? I'll hold hands
Nice.
with the person. We're actually working with Paul Zakos in the county right now to look at creating an additional spot. So those wheels are already turning to
Okay,
create
very
a
good.
spot in the
Keep us
courthouse.
posted.
And how soon would you fill the 2 positions?
As soon as you say yes. Anybody available? How about you? Childs?
All right, any other questions? Would you prompt the vote, please?
Yes, 6 yeas and 0 nays.
All right, the motion is unanimous.
It's a
Thank you.
Christmas miracle.
Thank you.
Thank you so much.
Thank you.
Thank you.
We move on to our Sheriff's Office recommendations. There are 6 items. A reimbursement from the Bureau of Alcohol, Tobacco, Firearms, and Explosives for fiscal year 2024 overtime. The next item is an acceptance from the Michigan Department of Natural Resources for the fiscal year 2024 off-road vehicle law enforcement services. The third is acceptance from the Transportation Improvement Association for the 2024 traffic safety enforcement. The next item is an amendment to the enforcement service agreement with the Township of Independence. The next is an amendment to the agreement with Commerce, and the last item is an amendment to the agreement with the Township of Lyon. Who wants to make a motion? I have a motion by Commissioner Powell, support from Commissioner Joliet. And we have our undersheriff and Guy up here to talk about the items.
Good morning and Happy New Year.
Good morning, happy New Year.
So the first one is our memorandum of agreement updated with the ATF, the Bureau of Alcohol, Tobacco and Firearms. It's a not to exceed amount of a little over 82,000 for overtime. We have 4 different officers in the task force, and it covers up to a little over 20,000 for each per officer. The next one is from the Michigan Department of Natural Resources, our 2024 ORV grant from Michigan DNR. It's 25,000. It's for staffing of the park with Parks. So Melissa Prowse is also here if you have any questions on it. We work in partnership with Parks on this grant. And it's also for the purchase of an additional ORV this year, so
Yeah,
to
I
give us some additional money.
Yeah, I would just add that we asked for 15,000, which more than covers our expenses for law enforcement at the ORV park, and they gave us a grant for 25, and we said,
Alright.
thank you, we will buy an additional vehicle with it, so we're very happy about that.
Thank you.
Okay, the next one is our annual Traffic Improvement Association grant. It's 63,000 for overtime. These are targeted patrols that focus on, there's different time periods of the year, distracted driving, operating while impaired, safety belts, and speed. The next one is amendment number 2 to our law enforcement agreement with Independence Township. They are asking us to add an additional patrol investigator. The next one is amendment number 2 to Commerce Township, and they are asking to add 1 patrol sergeant position. They currently have 2, this one adds a 3rd one, so then each shift, there's now gonna be a sergeant on each shift. Lyon Township is the next one, and it's amendment number 3 to their agreement. They're asking to add 1 detective sergeant and 1 deputy 2 no-fill position.
I'm sorry, one what?
Or 1 detective sergeant and then 1 deputy 2 no-fill, so
Deputy
regular
2.
road deputy.
Thank you. Thank you. Commissioner Powell?
And with these added positions, the townships, they pay for this, correct?
Oh, yes,
Okay,
yeah,
I was
yeah.
just making that clear.
Yep, we bill
Okay.
them and
Right, I just wanted to make
absolutely,
that clear,
yes.
yes, thank you.
Commissioner Gershenson?
And with the additional bike for the,
Oh, it's a side-by-side, a quad vehicle.
okay, so has demand, I've never seen any numbers or anything about how successful that program is. Does it generate income or does it pay for itself?
At the ORV park?
Yeah.
Yeah, so this is actually the first year that we are revenue positive. Our goal was to be revenue positive by year 5, and all the revenue that we're making at the park over expenditure goes back into the park. So I think we're close to $100,000 in revenue over expense this last year, so that'll go back into the park. So we're doing very
And
well.
so the demand is there for
The demand
this.
is there, yep.
Okay, great.
Thank you.
Yeah.
All right, any other questions? Would you prompt the vote, please?
Commissioner Taylor?
Yes. It didn't come up on my screen.
Okay, I'll watch it from this one. You have 7 yeas and 0 nays.
All right, the motion is unanimous. Thank you very much.
Thank you.
The next item is from Health and Human Services. There are 6 items under recommendations. The first 3 are applications. 1 to Michigan Health Endowment Fund for the 2024 Maternal and Infant Health Initiative Preconception Nutrition and Wellness Program. The next is an application to the Michigan Department of Environment, Great Lakes and Energy for the 2024-25 Inland Lake Beach Monitoring Program. The next application is to the Michigan Health Endowment Fund for the 2024 Maternal and Infant Health Initiative Mental Health Consultation for Maternal Infant Health Home Visiting Staff. The next item is an amendment to the Huron Valley School District Interlocal Service Agreement. The 5th item is another interlocal agreement with Luce, Mackinac, Alger, and Schoolcraft District Health Department. And the last item is accepting the 23-24 Housing Education Program grant from the Michigan State Housing Development Authority. Who would like to make, I have a motion by Commissioner Nelson, support from Commissioner Taylor. And, oh, we have Leanne Stafford online here to talk about these items. Thank you.
Hi, Happy New Year, everyone. Happy to be here. We always like to bring lots of items to you. So the first item, the application that we're looking to request from you is to put in a request to ask NDHHS for a mental health consultant. And so, as you know, our nurses that are in the field have a lot of families that are dealing with trauma. And so what this grant looks to do is to hire a mental health consultant that will come in and provide continuous training across all of our nurses and actually throughout the health division to help with clients that come in with trauma, and so that they can be informed on how to provide care as they go out into the field. And so this grant, we're asking for $200,000. It's a 2-year grant, so it would help us keep that consultant on full-time through that 2 years to help with that training in that capacity. Do you want me to go through them all and then we can ask questions?
Yes, thank you.
Okay. So the next one is actually, we call it an application, but actually what it is it's us just submitting to DEQ, or actually Eagle now, our request for funding for the beach program that we do annually. So this is actually a new grant. It's really the same, but we call it a new because we've had the same one for 5 years. And so we are requesting, they're telling us that they're going to give us $83,946 to do the work, and that's 6 sanitarians. They're student sanitarians that come in and do our beach sampling for the summer. So just a little bit of information, because I always know that this is a hot topic for individuals. Last year we did about 100 beaches sampling. That's on 78 different lakes. So each year we sample about 50 public beaches. And so that's going to be your state, county, and city park beaches, commercial beaches like our pay to swim, country clubs, and then also any kind of educational institution or foster care if they have some kind of beach where they take kids, or children's camp. Those are tested on an annual basis. Then we take the other 200 beaches and we basically put them on a rotation, that they are sampled no more, or no less than every 5 years. So if we have a beach that struggles, right, from year to year, they may stay on an annual basis until we get them in a good place. So again, about 100 beaches each year, and this money helps pay for those students, what we call student sanitarians that come in from different schools and help us with this work. I think the next one is also, sorry, I just want to make sure I'm not missing something.
Home visiting staff for the infant.
Home visiting staff. Oh, hold on a second. Make sure I have this. Sorry, I do not have that one in front of me. So I'm going to have to come back to that one in just a second, if that's okay. The other one is Huron Valley School District. So that is an amendment to do sampling for them. So we enter into agreement and they pay us to go out and actually do sampling in the community. We actually they actually pay for our mileage to go out and do those samples. So we have staff that are trained to go out and take those samples so that we can ensure that they're taken. That is a requirement that they are required to do, to look for chemicals that are in the water out there. So they pay us to do that, which is a nice partnership that we have had for a while. So the next one is the new, and we have been requested by the LMAS district in Michigan, which is Luce, Mackinac, Alger, and Schoolcraft district health departments, to come in and train. Actually, they're going to come to us and train food sanitarians. And so what that is we have standardized trainers, and because they are short-staffed, they have asked for their staff to come and be trained by our sanitarians that are considered standardized by the state. And so it's a very specific process that someone has to go through before they can go out and actually inspect restaurants. The state actually sets a requirement. And so they are looking to ask us to come in until they can provide those standardized screeners in the near future. So again, a partnership with a local health department that we have not had in the past, but very excited to be able to provide that. So, and then the other infant, I'm gonna have to go find the paperwork. I am very, very sorry. I do not have it in front of me, and I wanna make sure I provide you all the right information. So I don't know if we can hold on that one and we can come back and discuss it. I don't have it in front of me. I apologize.
Yeah, it can be
Well, it's the,
Khadija's item, and then we can come back to.
yes.
Yeah.
Yep. We'd be happy to do that.
Okay.
Read what we have, but, so the,
I'll go look for that and come right back. I'm sorry, I just don't have it in front of me.
no worries. Do you have information on the housing education program?
Here that's gonna speak about that.
I'm sorry, say it again? Oh,
Khadija.
thank you. Welcome.
Hello, good morning, everybody. Yes, I will speak briefly about acceptance from the Michigan State Housing Development Authority for our 2023-2024 Housing Education Program grant. This is basically a renewal grant. We have received this grant for many, many years from MSHDA. It helps to support our housing counseling staffing. We have 3 staff that currently come out of that grant, and the services are enormously important to our Oakland County residents. The counselors provide education to Oakland County residents around home ownership, budgeting, taxes, help them with reverse mortgages if they're over 62, and just a plethora of other things just to help inform and support people in making good decisions. And so acceptance of this $20,000 grant will help contribute to the salaries and the operations of that portion of the program.
Thank you.
Thank you.
Okay, so right now we have 5 items from Health and Human Services. Vote on the, yes,
I have a
Commissioner
question
Dolan.
about
Yeah,
one of them.
I have a
Sure.
question, Jeff.
go ahead.
Is Leanne still on?
No. Oh, maybe.
She's present, but her camera's off.
All right, well, if you guys wanna.
Mine's for her too.
Oh.
Mine too.
Then we'll wait just a moment. Pretend you hear elevator music in the background.
Oh, thank you. Yeah. There's a Christmas wax on it. It's supposed to be like Greek cards.
So the item she's looking for is a grant application to the Michigan Health Endowment Fund for $200,000.
Okay. I'm back, sorry. There was a confusion, I apologize. So the second grant application is also through the Michigan Health Endowment Fund, and it's focused around maternal and infant health. And this is really focused, again, our nutrition team that goes out. For those of you that maybe don't know about our nutrition program, is we have nutritionists that do home visits that really help kids that are maybe at birth, maybe have struggle with eating or maybe very low birth weights. And so physicians are actually refer clients to our nutritionists, and they go out and they help teach parents, maybe a mom, how to breastfeed, right? Maybe she's struggling and the baby has very low birth weight, or maybe they're failure to thrive, so they're not eating. And so these nutritionists go out and actually provide that service. Well, what this is going to do is it's going to even add and encouraging healthy eating to interconception. So somebody that's maybe trying to get pregnant or has been looking to get pregnant or maybe is pregnant in the very low, first stages, and really teaching people how to eat correctly when they're out in the field. So it really looks at decreasing low birth rates. So if people are eating correctly when they're trying to get pregnant, or maybe when they're early pregnancy. And so we're really looking to start providing this training programming. We'll target women in childbearing age in Pontiac. And we will also look to throughout the county, where if people want us to come in certain times and provide an RD or a registered dietitian to come in and provide that training. And so it's really just looking at ways to encourage women that are at childbearing age, proper eating techniques, moving through the full process of having their baby.
Thank you.
So these applications are due. They're actually the first two, the first one I talked about that talked about the maternal child health, or bringing in a mental health consultation, is also through Michigan Health Endowment Fund as well. So.
Thank you. When I did home-based therapy for years, one common factor was that it taught a lot of the parents to cook. So I was surprised that that was one direction that I would go into, but you're right, nutrition and sleep makes such a difference for people, and a parent knowing how to cook is certainly helpful. All right, Commissioner Joliet has a question.
Thank you. A quick question about the inland lake beach monitoring. So you say there's 200 beaches on a rotation. Is there a list available for what beaches will be done this year?
They have not generated that list yet, but if we get this money, which we're assuming, we will, generally we do, they will generate that list. But I can get you the 50 public beaches that are done each year. It's likely on our website, because they would be the same 50, but that way I can make sure you have the correct 50 public beaches. The 200 beaches, I don't know if they have actually generated that list yet, but when they do that, I can make sure that gets to the team or the commissioners.
Thank you. Will that be on the website? I'm on 8 lake boards, and they're all wanting, so I fall under the private beaches category. So if that will be available on the website at some point?
It does, yeah. So very soon, right, they'll start to think about summer, right? Sanitarians are coming in, and they'll start to put those lists together. They'll look at last year's, right, maybe some beaches that we struggled with to, kind of get up to code, on a continuous basis. And then they'll look at those other beaches that we need to rotate in. Perfect. So yeah, it's on our health division website, but I can make sure I get that to Barbara so she can push that out to all the commissioners, so you all have that.
All right, thank you.
Thank you. Commissioner Gershenson?
Oh, thank you. Along the same lines, so are you saying we have 6 sanitarians, period, for the lakes?
Yeah, well, they're student sanitarians. So they come in to really, their focus is to handle the beaches, and then they also rotate and learn about public health. Most of them, actually all of them, are in some kind of environmental health or public health program.
Okay, so testing a lake once every 5 years is insufficient, and this has been a big issue for me for many years. And I started collaborating with environmental groups, and we did a great a pilot program where they trained people, and we worked together on that. So I'm going to be looking at starting something again, because I really feel we need more we need lakes tested more than once every 5 years. So maybe you want to work with me on that, because I know MSU Extension is interested. We worked with some of the conservation groups before, so maybe we can put together some sort of shore program for utilizing volunteers for lake testing like we did before.
That's a really good.
Okay.
Yeah.
Commissioner Nelson, followed by Commissioner Powell.
Thank you,
then
Madam
Commissioner
Chair.
Cabell.
Happy New Year, Leanne. Just to kind of piggyback. Oh, I'm sorry.
No, go ahead, sorry.
I'm gonna piggyback off of my fellow commissioners. Well, first and foremost, given that Oakland County does have the most inland lakes than any other county in Michigan, I do appreciate that Oakland County is dedicating resources to lake monitoring, especially given, and I did not know this, especially given that the beach monitoring program is not a mandated program. So while I do wholeheartedly agree that once every 5 years isn't sufficient enough, I am grateful that we are taking advantage of still dedicating resources because we don't have to. But I value that, so thank you. The one question I do have, it kind of piggyback off of Commissioner Joliet's question. I saw within the agenda item that there are 88 beaches that get selected for sampling. What is the criteria to determine those 88 lakes out of the list of the lakes in the Appendix A?
Yeah, so again, we try to do what we call our public beaches every year, right? So those are our like kind of government-owned, state, county, right? Probably the most visited type of, beaches. Those are done annually, and that is about 50. So then there's about 50 additional beaches, right, that we rotate every 5 years. So it ends up being about 100 beaches each year. That's what we did last year, average. There might be a few less, a few more, depending on the drive distance, right? Because we have 6 sanitarians that try to share the whole county. And then there were 78 lakes. So we might choose different beaches on different lakes. And again, it's just a rotation. So those additional 50 that we may sample every 5 years, we'll look at, okay, maybe one lake last year was closed, I'm using this at 5 out of the 10 weeks that we sampled, right? So we would bring them back into that annual lake sampling. So then the others, right, let's just say we have a 40 additional that we're just doing a rotation. So if they have not been sampled in the last 3 years or 4 years, they come back on the list. So we try to make sure that every beach is sampled at least every 5 years. We'd like to do them more, frequently, of course, and people will sample their own beaches, right? So we also have that opportunity where people can do their own sampling at their lakes, if they're interested in doing that a little more frequently.
Excellent.
So just a rotation.
Excellent. Thank you. Thank you, Madam Chair.
Commissioner Powell?
Is there a reason, well, I'm new to this lake thing, can you explain to me why why is it just the 5 years? Is it a staffing capacity? Is it a funding thing? I'm just asking for my knowledge because I'm new to this.
Yeah, I think it's a little bit of both, right? So when the sanitarians come in, right? I was a student sanitarian, so I did this 24 years ago. So I know a lot about this program. We're trying to, obviously do all the public beaches and then trying to still do this rotation, but we're also giving them kind of an understanding. It's an internship of what public health is about, right? So we want them to go out and inspect restaurants and do, this and that. And so it's kind of a internship of all. We also have staff, though, that continue sampling sanitarians after our sanitarians leave. So if we want to continue sampling a beach that's having a problem after Labor Day, we'll keep our staff on it to continue to monitor. But this has kind of been the process, right? We're trying to get public beaches and semi-public beaches sampled as frequently as possible. And that's kind of the rotation we put them on.
And one more question? Sure. Yep. And my second question is, can you give us the time frame? When does this testing kick off? And I know it kind of proceeds through probably Labor Day, but when do you actually kick this all off? Like, when did the testing start?
Yeah, we try to do 10 weeks, so around Memorial Day to Labor Day.
Okay.
So, yeah.
Commissioner Cavell, followed by Commissioner Gershenson.
Yeah, I have a question and then kind of a statement, I guess. Leanne, all the Michigan Health Endowment Fund things, were you able to work with, or does it help working with Sarah, the new Philanthropy Director? And how do you see that relationship working?
Yeah, she actually brought this opportunity to us, and so then we were able to, yes, Sarah and I have known each other for a while, so she brought this to us, and so we were able to we'll submit 2 applications for this one grant, so.
That is
yes.
cool. Does everyone understand the context of that?
Yeah.
I was a board of initiative to make a philanthropy person, and Sarah's that person, and so she brought these 2 things to us, which could be $400,000. Which, while the statement part's coming, while we figure out our priorities and values, because your budget is your value statement, and Leanne's budget's 36 million, and Khadijah's budget's 16 million, and our IT budget's almost 89 million. You know, we only inspect lakes every 5 years because of those numbers. So while we reorganize our values and priorities, Sarah, the Philanthropy Director, is very helpful in filling those gaps.
Thank you. Commissioner Gershenson?
So I'd like to meet Sarah.
Great.
Does she come
She lives in
to-
Huntington Woods. She's awesome.
Does she come to any of our meetings? Have we met her?
I know that she scheduled meetings with, she's fairly new to the county. She started late last year. She was kind enough to meet with the board staff. So she has I don't know where
Okay.
I'm sure there was a meeting.
Yeah,
with-
could you send me her contact info?
Of course,
Okay,
of
great.
course.
So, Leanne, am I to understand that the 6 sanitarians, the grant is $83,000? So if we were to come up with an additional $83,000, would you be able to find another 6 sanitarians?
That might be, well, again, I'm not sure because I don't hire for those positions. I know the pool of people has kind of gotten smaller and smaller. I would definitely want to talk to our staff about that, if we could get 6 additional people in here to be able to provide that staffing. So
Okay,
I can get back to you on that. I'll talk to that team.
thank you.
Commissioner Nelson?
Actually, Commissioner Gershenson asked the question, so.
I was gonna say we could do a thing.
Absolutely.
Are there any other questions or comments? All right, would you prompt the vote, please?
Marsha, you led one of the initiatives prior to lake monitoring, right?
Say it again?
You led a previous initiative, right?
Yeah.
Yeah, let's talk about, yeah, I know, several individuals in my community
Okay.
were a part of that in the past.
Okay.
But everybody's gonna do their part.
We can rent from these kids.
No. I saw prompts come up. Did everyone press theirs?
Yes.
They're
Yes.
not coming in on my end, so I'm probably just gonna verbally ask this one real quick.
Okay.
Juliet,
Yes.
Nelson,
Yes.
Howe,
Yes.
Gershenson,
Yes.
Cabell,
Yes.
Erickson Dahl,
Yes.
Taylor,
Yes.
Loops.
Yes.
You have 8 yeas and 0 nays.
All right, all of your items are approved unanimously. Thank you, Leanne and Khadijah. Oh, it comes up on our, came up on our. Okay, all right, thank you. Moving on, we next move to the emergency management recommendation. There is one item. An agreement for the city of Rochester Hills to monitor the city's supervisory control and data acquisition system, which it sounds like we've been doing for many years. Who would like to make a motion? I have a motion by Commissioner Nelson, support from Commissioner Gershenson. And Tom Hardesty and Michael Crum are here to talk about this item.
Good morning, Commissioners. Like your colors, Commissioner.
Good night.
Thank you for the opportunity to come in front of you today to review this contract. As she mentioned, Mike Crum, the Chief of Building Safety, is here. That division oversees the contract, so I'll let him give you an overview of what that is.
Thank you. I'm Mike Crum from Building Safety. This is just an extension or a continuation of a long-standing collaboration or work with Rochester Hills. This interlocal agreement. We provide 24-hour monitoring of their alarms for a SCADA system, which is really their water treatment or their wastewater program. We do this for WRC here, for the county, Water Resource Commission here, and for And since we're here doing that, it's just an extension of that for Rochester Hills. We primarily look after hours, weekends, holidays. So during the normal Monday to Friday, they provide the service in the city. So it looks like we have about 57 alarm points that we do for the city of Rochester Hills, and the number inside of this document that we have is 12,312 annually. And the document we have is for the next 2 years, and then with the possibility of extending.
Thank you. Comments or questions regarding this item? Commissioner Cavell?
Hey, how did you figure out that it should be $18 and has that gone up?
It has not gone up.
Since when?
I've been here 2.5 years. The last contract that I had was the same number. I don't know previously.
It's a pretty low number of views for them, so it's a benefit for them because it's still cheaper than them paying somebody to do it 24/7. And then on our side, it's revenue that helps support staff that are already there anyway, so it ends up being a win-win.
Do you do this for other towns, or is this just one that asks for it?
This is the only one we don't really solicit for it. We would be there if there were others that were interested, again, because we're there, but we haven't really gone out and solicited for business.
Thank you. Any other questions? All right, would you prompt the vote?
Asking me a question. I was gonna ask what our costs.
Well, which it might, we don't know.
He said we get revenue from it.
Yeah, that's just a technical term.
Taylor?
Yes.
Thank you.
The sheriff does that a lot.
8 yeas and 0 nays.
All right, the motion is unanimous. Thank you.
Thank you.
Which is fine. But then if we just
Our last scheduled item on our agenda is a public service recommendation. Directions, a data use agreement for the National Pre-Trial Reporting Program with the Department of Justice's Bureau of Justice Statistics. I have a motion by Commissioner Nelson, support from Commissioner Christensen. And we have Eric Schmidt here to talk about.
Good morning, everyone. Yes, it's quite a mouthful, but Community Corrections is seeking to enter into a data use agreement with the Bureau of Justice Statistics to participate in the National Pretrial Reporting Program. And the project has been vetted and approved as secure by Oakland County IT regarding the data security for releasing what would be PII coming out of Community Corrections to the Bureau of Justice Statistics. And basically what the underlying core need for this project is that in the United States, there's really a massive lack or gap in criminal justice data and consolidation of that data and systems, especially as it relates to pretrial outcomes for defendants during the arrest to final adjudication phase of their cases. And so this lack of data is an obstacle in evaluating programming, case outcomes, and of course, more importantly, research on what works and what doesn't work in the pretrial phases of cases. And so entities that submit data into this warehouse are from 200 of the largest counties across the United States. So Oakland was, of course, provided the opportunity to participate. We've actually been working on the finalization of this data use agreement and all the loopholes that are required to make sure this is done appropriately and safe since 2021. So it's been a long-going project, but this will allow us to assess our own practices, compare our agency with others across the United States, and provide researchers the data on pretrial detention, release, misconduct, and appearance. The Oakland County Sheriff's Department was also offered the opportunity to participate. They will be doing so and sharing their data as it relates to pretrial phases of cases as well. And again, the data use agreement and data transfer portals have been vetted and approved by Information Technology Corporation Council and Risk Management. And the data itself is readily available actually to our organization and our data management system. And so we will be able to extract and send the data to the Bureau of Justice Statistics through our current user support specialist. And so there's no cost for extracting the data, which will be a one-time data pull for cases that we dealt with in 2019. So it is not an ongoing data release. It's a one-time data pull and provide to the warehouse.
Thank you. That was my question, whether it was just for the year 2019, pre-COVID. Anyways, we're
right
the other year. Thank you. Any other questions or comments? Commissioner Cavell?
Hey Eric, would this show information like, you said the Oakland County Sheriff's Office will also supply data, so does this show like the snapshot of in 2019, there were this many people pre-trial in Oakland County Jail? So like people that didn't make cash bail? Would it show data like that?
So yeah, so the data metrics vary. It's quite a long table of the type of information they're looking for, but yes, it will include booking, release dates, how were they released, whether or not they had misconduct, after making a release. They're going to be attempting to match a lot of data. That's why there is the request for the PII, so that they can overlay it with the jail information and possibly other systems if they get other partners. That will then they'll de-identify the data and move it into a system that researchers can gather to see how many cases were there, were they on pretrial supervision or not. It may even include what were our recommendations, but it's mainly people on pretrial supervised release. How long did it take for them to make release from the jail? So were there potentially, pretrial harms caused by being detained? And then what were their success rates as they made release and appeared for court?
Okay. So, and also you said the PII, it will be de-identifying, so the only people that will have these folks' identities will be like the data analysts at the Bureau of Justice or something.
That's true. So yes, only people with the Department of Justice, Bureau of Justice Statistics would have technically the ability to see that PII.
Okay, thank you. Thank you, Chair.
Thank you. Any other questions or comments? All right, would you prompt the vote?
You have 8 yeas and 0 nays.
Motion is unanimous. Thank you. Thanks for joining
Thank you.
us. Our last item is public comment. Is there anyone from the public wishing to comment? All right, public comment is closed. There is no other business to come before the Public Health and Safety Committee today, so our meeting is adjourned at 11:19. Thank you, everybody.